Good morning, or should I say good afternoon, and welcome to our Posturite webinar for Friday. It's going to be a glorious weekend, so give you something to think about when you're sitting in the sunshine. So today I'm delighted to say that we have Steve Carr with us, who is going to do a webinar on shift working, the risks, realities and resolutions. Steve has been the Company Health and Safety Officer for Fidelity International, one of the largest investment management organisations, for the last 10 years, and he's been instrumental in many activities there, including the introduction of automatic external defibrillators in all of Fidelity's UK and European offices. He's also spent some time looking into shift work, which is why he's going to be doing an informative webinar for us today. So really, apart from to say, if you've got any questions, please use the box on the right-hand side of your dashboard, and be aware also that we are recording this webinar, so if you have any technical problems or you wish to share it with your colleagues, you'll be able to do so by visiting our website. So really, without further ado, Steve, can I hand over to you, please?
Hi, thanks, Catherine. So shift working, it's a subject that many organisations don't recognise as constituting a significant hazard to their staff. They recognise that staff can get tired working night shift and things, but they don't really consider the effect on staff, and not just staff themselves, on their families and friends, and also on the wider public. Someone who has been on night shift, there have been several cases, well-documented accidents of people being overtired and causing fatalities. So really what I wanted to do today was just raise awareness of the subject and bring it to people's attention, and just give you a little bit of an idea of some of the research that's been done and some of the suggestions I came up with in our organisation in order to try and address these issues. So, what is shift work? I think before we get into what shift work is, we just want to say that once you've gone through this presentation, I hope it gives you some awareness of the subject, and I hope it raises some questions. Even if it just raises one question in your organisation, just something that you can think about, then it will have achieved its purpose. So, what is shift work? Is there a definition? Actually, there isn't really a definition of shift work, but these two definitions should work pretty well. A work activity scheduled outside of normal working hours, where there's a handover of duty from one individual or work group to another, or a pattern of work where one employee replaces another on the same job within a 24-hour period. Typically in most organisations, these shifts are spread between day shift and night shift, and typically they tend to be 12-hour shifts based on a 24-hour operation. You do get 8-hour shift patterns. They are fairly common, but in my experience, the 12-hour shift pattern's been the most common. So I've given you a couple of potential definitions, but is there any legislation around them? Not specifically. Obviously, we've got general duties under the Health and Safety at Work Act. We've got duties to assess the risks to employees under the Management of Safety at Work Regulations 99. We have to consult on employees' health and safety and how our operations affect their health and safety under regulation. I suppose the most specific one relating to shift work are the working time regulations, and essentially they limit night work to an average of 8 hours over a 17-week reference period. This doesn't mean you can't do 12-hour shifts. A lot of people think it does, but it doesn't. You may allow 12-hour shifts providing the average doesn't over 8 hours over 17 weeks, if that makes any sense whatsoever. What I really wanted to look at, I didn't want to spend too much time on the legal position, because ultimately This is more about looking after staff, and I've always felt that organisations, their first duty is a moral one rather than a legal one. If you can satisfy the moral duty to your employees, then the legal one shouldn't come into it. So I did an awful lot of research before I brought this presentation to you to try and find out if any studies had actually been done into the subject. I know within my organisation, before I took over, there had been very little research put into the effects of shift work on our employees, even though we have significant 24-hour operations. So what are the health effects? More than you might imagine. The human body, you might have heard about this, works to a circadian rhythm, an internal body clock. And most research suggests that rhythm operates on a 24-hour cycle. There are reports, there are studies that suggested a 25-hour cycle was more accurate. I tend to go with the 24-hour cycle in all the research I've done. People are geared to being awake and asleep over that period. What is well known is that if you mess about with someone's internal body clock, their sleep-wake cycles, then those cycles are disrupted. The human body circadian rhythm is disrupted. What that means, that tends to have profound effects on the workers themselves. And I did some research on how people tolerate shift work. And we're not just talking about night shift, although night shift has the biggest impact. It's the mixture of shifts and how you mix them and how you hand those shifts over and how you handle them that's important. And it's that mixture that people have difficulty in tolerating. So one of the very first studies that was done way back in about 87, found that only 10% of workers enjoyed shift work. Most people accepted it, but they didn't really enjoy it. But there was a significant amount, about a fifth of those workers who were identified couldn't tolerate it. They just couldn't get their heads around it. Age has also been identified as a factor as well. It tends to be the older you are, the less able you are to tolerate shift work. And typically, one of the focus groups, one of the studies I looked at was in a focus group with a mean age of about 44 years. And the older members of that group were far less able to tolerate shift work than the younger members were. There's also some anecdotal evidence that people who have been awake for long periods or people who have been doing shift work tend to make more mistakes, they tend to be less attentive, and some of the biggest disasters in recent times have happened in the early morning or when people who have been awake for long periods. The accident at 3 Mile Island was nearly about 4:30 in the morning. Chernobyl was about 1:30 in the morning. The Exxon Valdez was just after midnight. Now this is just anecdotal evidence, but it does seem to hang together that the biggest disasters that we've had in recent years all seem to occur when people have been awake for a long period of time. And that's a concern in any organisation that doesn't consider that people's performance and their judgment is going to be affected after being awake for a long time. They're going to cause themselves some problems. Also, shift work has been linked to a lot of medical conditions. Now, this isn't just because people are awake and asleep at different times and their circadian rhythms are affected, although that is relevant. When you look at this slide, when you look down that slide there, those conditions that I've highlighted, a lot of them are to do with poor diet, different eating times. The sleep-wake cycle is disrupted, so your eating times are disrupted. And certainly on night shift, with the focus group I looked at, those members of staff tended to have very poor diets. They tended to be eating fast food at night because it was hot and it was easy to get hold of. But doing that for a long period of time leads to, or can lead to, many of the conditions that I've noted here. Gastric and duodenal ulcers have been highlighted as one particular issue. Night shift workers have approximately double the chance of developing those kind of ulcers as compared to full-time day workers. Certain studies have identified that respiratory conditions such as asthma are more apparent in sufferers, and all of this is documented. I've also said that conditions requiring the administration of time-dependent medication can be affected, and that's because a person's sleep-wake cycle is disrupted, they're not going to be awake and asleep at the same time every week, which means that if they need to take time-dependent medication, they're going to have to wake themselves up to do it, depending on which shift they're on. That in itself can exacerbate the problems related to disrupting the circadian rhythm. There was also a major study in Scandinavia that found a link between shift work and reproductive health in women of childbearing age, which would suggest that at the very least, if you've got women who are perhaps expecting children, and maybe shift work or night shift work is not the right solution for them, and perhaps it should be considered to allow them full-time day shift until the little ones arrived, and then they can go back if they choose to a shift work cycle. The other one I wanted to mention was, I mentioned there a 2003 paper by Knutson. That brought together a number of previous studies. It didn't just look at one, it looked at an awful lot of studies, pretty much all the studies that were available at the time. This was, as I say, 2003. And they found that workers were about 40% greater risk of developing cardiovascular disease than day workers. Now, that is, again, you could argue it's anecdotal because there's a lot of outside factors. There's diet, there's lifestyle, there's other health conditions that we're not aware of. But at the very least, it shows that there is an increased risk, and it's something that we should be conscious of. So when this research was done, when I did this research for this report, I didn't just look at the studies out there. I actually interviewed the focus group, which for this group was all of the security officers in the organisation. They were all on 12-hour rotating shifts. They all do a mixture of day shift and night shift. So to get the same kind of answers from a very large number of them was interesting, but it was also concerning. So I just wanted to run through one or two of the actual real-time events rather than just relying on focuses and study groups. One of the interesting things was, the very first thing I've listed on this slide is that expenditure on food and cigarettes increased. Now, obviously, smoking's not good for you anyway, but when I asked the question as to why, the officer said, well, when you've got a certain amount of tasks to do overnight, they can get tired. Particularly if they're just monitoring a site, all they have to do is, maybe 2, 3, 4 hours of actual solid work. The rest of the time they're patrolling, or they're monitoring computers, or they're monitoring alarm systems. Which means that they were smoking more, they were eating fast food more, and that was costing them more than they would normally spend on a day shift. And then that was causing some financial pressure at home. One of the issues that concerned me the most was it was reported by the officers that driving home after a 12-hour shift was especially tiring. Now this has been identified by ROSPA, the Royal Society for the Prevention of Accidents, in their report in 2001. and it specifically identified driving home after a long night shift as being particular concern. And there wasn't a major accident at the time where a chap was driving home, not one of our staff, I hasten to add. Was driving home along the major motorway in the Midlands, crashed, and both he and several other people died. So it is a major concern. It's a concern that we have employees who live a relatively long distance away from the office and have to drive that distance after a long night shift. One of the other issues that was brought out that doesn't seem to have been picked up by any of the studies I've read was the social and family pressures for staff, particularly coming home from a night shift. So employees would have families, and those with children tended to get lumped with the job of the school run. Not that it's a bad job to do, but it means that an employee who's just come in off a night shift is then expected to do the school run, take their children to school. Then they would not get to bed until after the school run had been completed. Then they would be expected to pick up the children again. So they were only getting 4 or 5 hours of quality sleep, because by the time they did the return school run, brought the children home, it was time to make dinner, and then it was more or less time to go to work again. Now here's the thing. We're not just talking about somebody who's just in a 12-hour night shift. You've got to consider the time he was awake before he went to work the previous day. So if you add it all up, cumulative lost sleep is very, very significant indeed. So at the end of a 3-day night shift, the officer was considerably more tired than he would be if he was doing day shift. It's just one to bear in mind. It was borne out by quite a few of the officers that I interviewed. And the result of that, the result of them being so tired, the employees were being less tolerant at work, more irritable, less able to concentrate, and much more prone to making mistakes. Now, if that's happening in the office, where they're at work, where they've got stimulants to keep them awake, the worry is, what's that doing to them on the drive home? I think we've all been tired. Those of you who drive will all recognise that driving while tired is dangerous, and it's one of the big concerns I had when I put this risk assessment together. So there's a fair few negatives there, but what about the positives? Is there anything good about night shift working? Well, the officers did report some. Not having to drive at peak times was much easier for them. The traffic was lighter, so the journey was less stressful. You could argue that's lucky, because if they're driving home and it's out of rush hour, then they've got less chance of being involved in an accident than they would have if it was through the day. Now, the way my organisation arrange our shift patterns, it tends to be it tends to be 2 days on, 2 days off, 3 days on, 2 days off, 2 days on. Working on that shift pattern, employees would only need to take 2 days of their annual leave in order to get 7 days off work, if they timed it correctly. And that was a big bonus for them. They did have the opportunity to spend some quality time at home with their families, particularly in the school holidays. However, again, if it was in the middle of a bunch of shifts, then that could and did erode some of their sleep time. So that's a bit of a double-edged sword. They did save money on childcare costs for those of them with younger children, and it meant they didn't. Not only did they not have to pay for childcare, but they didn't have to arrange childcare either. Again, a double-edged sword. If they're looking after the children, they can't be asleep. So you could argue it both ways, but these were what were reported by the officers. And the officers did say that they were able to undertake hobbies and sports at cheaper rates than they would normally pay if they were working a normal 9 to 5 job. So on the 2 days that they were off through the week, for example, if they didn't need to sleep, it's a lot cheaper to go to the gym at 2 o'clock in the afternoon or 10 o'clock in the morning than it is at 5 o'clock in the evening. One area of major concern that was reported, and I was only officers only told me this if I promised not to give any names out. Some of them reported that they took additional part-time work, even if it was just something like delivering leaflets or other casual work to boost their income because they had days off. It's not something I support at all. I believe firmly that the time between shifts is time to allow your circadian rhythm to get back into kilter. And I would strongly, strongly discourage anyone from taking secondary work if they work at a shift work rota. So we've given the positives, we've given the negatives, we've given some background. I haven't gone into it in too much depth because we haven't got much time today. But what can we do? How can we try and address some of the issues I've raised today? You can't really adopt a hierarchy of controls. You can in a limited way, but a lot of this has got to do with how you manage the shifts, how you put them together, and how you allow your workers to recuperate between shifts. Obviously, the best way under any hierarchy of controls is to eliminate the risk entirely. Don't adopt shift working. Is that realistic? No, not really. Organisations have shift work because they operate 24-hour operations. In my organisation, we're a worldwide organisation, so they're monitoring not just officers in the UK, but all the way across Europe, Asia, Australia. So it's not really a feasible option to remove shift working entirely. So the only thing you can really do is try and reduce the risk. You could shorten the shifts from 12 hours to 8 hours. What that does, though, is it introduces an extra shift, means the organisation will have to employ more officers to do the same role for the same period of time. So the organisation wasn't keen on it. Neither would the employees. The employees would rather work a 12-hour shift than an 8-hour shift because it gave them more flexibility. It gave them, it was easier for them to arrange holidays for the reasons I said earlier about getting 2 days off to get a week's holiday. So what can we do? What can we do to try and reduce this problem? Well, certainly in the security officer's role, there's a lot of driving involved. They drive between sites overnight. So you need to, one of the things you should do is introduce a driving ban between 3 and 5 o'clock in the morning, unless it's absolutely necessary. And that's borne out because the maximum period of sleepiness during a night shift is at 4 a.m. You need to try and reduce the boredom. Give them something to do. Give them something to focus on. Give them something that's demonstrable that they have to achieve through the night. Now, I'm not saying they have to go and do something really physically, excessively demanding, but just something that they know they have to do, they know they have to complete. That gets rid of the boredom, or reduces the boredom. That will reduce the incidences of smoking, and it'll keep them active. You don't want to increase their tiredness, but certainly you want to try and keep them active so that their tiredness doesn't increase. You could concentrate recruitment within a stated radius of the office, say about 30 miles. It's about half an hour's drive or so. Now, it does reduce the hazards and the risks associated with driving while tired, not just to the officer, but to the other road users and pedestrians, which is a good thing. The downside is it reduces the quantity and caliber of candidates available to the organisation. So it may be less easy to achieve than one might think. You could also offer travel subsidies to discourage car use. You could offer car sharing schemes, you could offer vouchers, travel vouchers, anything to try and reduce the amount of time the officer needs to drive to and from work, even if he does have to drive while he's there. You could introduce health monitoring. Now, as I said earlier, there's a number of conditions that have been associated with shift work, both because of the disruption to the circadian rhythm and also because of the poor diet and lack of exercise. So if you introduce some kind of regular health monitoring, you could assist in early detection of cardiovascular, gastrointestinal, or occupational stress-related conditions. You could make subsidized healthy food options available. So it's not such a problem for day shift. They have access to healthy food options from the deli bars, from the restaurants. The problem is with night shift. So how do you do that? You could offer healthy food options in vending machines. You could offer vouchers for local retailers. Anything to try and help educate the officers into better eating. You could make fresh fruit available to them overnight, for example. And you could offer subsidized anti-smoking measures. Anything to try and reduce the incidences of smoking in the office or at work has got to be a good thing. It will reduce the incidences of smoking-related diseases. So I hope I've given you one or two pointers, one or two things to think about. I suppose the key takeaway from this is shift working does present a hazard, and not just to the person themselves. It presents hazards to the employee, to their families, and to all the people affected by our operations and by their operations. So it really does bear thinking about just a little. Thank you for listening to me today. Thank you for your time. And if you have any questions, I'd be happy to answer them.
Thank you, Steve. That was brilliant, actually. I've been sitting here scrawling notes, so I'm afraid I'm going to ask some questions to start off with. As I said, there's so much going on in my head to do with so many of the side effects or the negative things that you talk about, mirror what we talk about with so much of the stress issues we have today. It's anything putting the person under stress, and so there was a lot of things going on in my mind. But one of the things that I come across when I'm talking to people who do shifts is people say to me, oh, well, I've been doing shifts for years and I've adapted. Do you know if there's any research to show that people actually do adapt?
The research I've read kind of goes the other way. They tolerate shifts very well in the early days. And as they get older, they tend to not adapt so much, but they get used to them. Nobody I spoke to, I can't remember speaking to a single person who enjoyed shift work. And they kind of just accept it and go on with it. But as for adapting, it takes a very special kind of person to be able to adapt to shift work and actually get used to it without any effects on their health. Even those people who have said they've adapted to it, you see them at the end of a three-night shift period and they are tired. So I think people tolerate it. I'm not convinced that they adapt to it particularly.
Yeah, I think probably I'd be in a similar vein on that one. But as I say, I've not spent a lot of time looking at this particular topic, so that's helpful. I'm also sort of thinking that with the way of agile working and flexible working and people's lifestyles, I wonder whether actually a lot more of us are actually working shifts, whether at home or at work, than we used to. And I'm not sure, do you know of anyone who's actually doing training to educate people who don't do traditional shift work on the dangers of working outside a normal circadian pattern?
I'm not aware of any research, actually. That's a good question. I'll have to look that up. So why don't you throw that one to me after this, and I'll see if I can find any research. I certainly didn't find any when I did the original risk assessment for this, because agile working was much less prevalent than it's become in the last year or two. But it's a good question. I suspect that people working from home, for example, can have their own natural breaks. They're not under as much scrutiny. As long as the job gets done within a given time period, I think most organisations, that's what their expectation is. And it means the employee's got a lot more flexibility on breaks they take and where they take them and how they take them. They've also got a lot more choice in what they eat and when they eat. So one of the big problems with the conditions I mentioned in my presentation was a lot of those were related to people having very poor diets and very sporadic meal times. So I think working from home in particular, I think that is less of an issue. But I'll certainly look around and see if there's any more research because I haven't seen any.
Yes, as I say, it's always good when you listen to these things and it starts the cogs in your mind going. And actually, one of the other things I thought of is it's amazing with all these negative outputs. So many of our critical job roles, the paramedics, the fire, the police, are doing the long shift patterns, aren't they? And we are perhaps putting them in a position where decision making could be impaired. So right, actually, we've just come up to 1 o'clock, so I think actually we haven't got any time for more questions. So I think I need to sort of round things up now. Before I go, I just want to remind you that on Friday, the 21st of July, we'll have our next webinar. And actually, I shall be doing a webinar on off-site DSE use, out of sight or out of mind. So there you go. So if you're interested in that, I'd love to for you to join me on the 21st. Otherwise, if you wish to listen to this again, please go to our website and you'll find that there. If you have any further questions, please email them through and I'm sure we can pass them on to Steve and see if he can answer them. So otherwise, I'm going to let you go and enjoy your weekend and say thank you to Steve, and I look forward to seeing you all soon sometime. Goodbye now.
Thank you. Bye-bye.